Hello and welcome to this brief training on self-care and applying psychological first aid strategies for healthcare professionals responding to COVID-19. This training is a collaboration between the Minnesota Department of Health and the Metropolitan Health and Medical Preparedness Coalition. This training is brief and intentional, and in future we hope to put out other types of training similar to this. Healthcare professionals by no means are strangers to stress. On any routine basis, we have to manage a complex world. With COVID-19, the management of that complex world has changed significantly. What is normal for our stress and what is abnormal has changed in a significant manner. In this presentation, we will take a look at what those unique stressors are about and specifically go into strategies that will help improve our quality of life and in turn the care that we provide to our patients and how we manage our life outside of work. Over the years in training concepts in psychological first aid, we have always evaluated events and the impact of those events and the traumatic stress that they can create. COVID-19 is clearly very significant in the manner that all the boxes are checked. The event is unexpected. We know that people are dying. We know that this is impacting the lives of our children. We don't really clearly have a time frame, which causes our sense of the unknown, living with a virus around us, which you can't see, smell, hear. We have significance in this, which deeply impacts how we experience stress. And the fact that it is a global event impacting every single part of life makes this truly something where we have to take a deep dive in managing the impact of the stress of this event. Loss. Loss has always been part of our work in understanding psychological first aid and the impact of different traumatic events on all of us. One of the core concepts that we always turn to is that sense of connecting and touch and interaction. As you see in this slide, this is really a common thing where we can do, but all of a sudden we are being told, can't do that. You have to have distance. You can't interact 6 feet from people. This becomes a primary element of our concerns of how we respond and react. We have lost the ability to control our world in the way that we're used to. The way that we connect with people who we're concerned about, who are ill, emotionally distraught, is really a huge barrier for many of us all over. And we have to think about this in some unique ways. On this slide, you see several common and expected reactions to the types of stressors we're dealing with today. When you look through this list, you may have some, you may have a few, you may have things going on for you that are not even listed. You know, when we think about this and look at it, we may have these moments where we're maybe just a little bit more irritable. We may be struggling with some of that sleep issues, where we're really in some ways told to be socially distancing, which in some ways may work better for some of us, and for others may not be very helpful. That sense of how do we manage through this over time is going to carry that sense of ups and downs in our emotional state and our reactions. Self-awareness becomes a fundamental key of understanding what types of strategies will be most effective for you. Compassion fatigue is a critical concept to understand. It's been within the disaster mental health professional world for many, many years. Compassion fatigue is the residue that's left on us as it relates to many things we deal with. It's the combination between the experience of feeling burnt out, overwhelmed from the work that we're doing, and the elements of the trauma that we see day to day, and especially with the complexity of the events that COVID-19 brings. The combination of secondary trauma and burnout creates compassion fatigue, and over time, it really indicates the importance of managing that fatigue and being very intentional in how we do the strategies. In our next slides, we're going to talk about those strategies that relate to how we take care of ourselves. Here you have a self-triage document that's going to help you create that level of awareness that I'm talking about. It is really a check the box about what you're experiencing on a day-by-day basis over a week's period of time. I think many of these items listed are fairly straightforward in what their intent is and what you're experiencing. So for instance, if you're working longer than normal hours, which is common for many of us, you check the box. Though when you look towards the bottom on the left, with these different sort of experience, it says, was directly impacted by COVID-19. The intent here is if you are personally impacted, meaning yourself, friends, loved ones, are experiencing COVID-19 signs, symptoms, or illness, we want to make sure that you are aware of this. So take a look on the blue on the right upper hand side. You're going to see the beginning of our discussion around different strategies of managing stress. One of my favorite strategies is number 2. To help reduce physical tension is the concept of breathing and very intentional deep breathing, just sort of that slow inhale, a couple seconds, pause for a couple seconds, and slow exhale. When you think about this exercise, it's the intention of really experiencing the breath and only thinking about the breath itself, feeling the inhalation, the experience of the air flowing throughout different parts of your body. And you know, many of these things clearly are things that we're self-aware, right? The amount of caffeine we bring into our body, eating healthy. This is an event that you have to strategize over time, not days, not weeks, but really looking at multiple weeks and possibly multiple months. Some of you may be familiar with the Minnesota Psychological First Aid card. This is the back side of that card, and I want to spend a little bit of time talking about prevention strategies and overall self-care. So when we take a look at some of the lists on the back of this card, you're going to notice that we talk about regular exercise. And one of the things that I think about here is that we must think about how we exercise, how we move, how do we take breaks, to be more intentional in those strategies. One of the things that we know, and it's really well researched, is the way we create mindfulness around when we do things that are helpful for us. For instance, you decide to take a short break or after regular work hours to take a walk. Think before you go out on that walk about how you want to feel during the walk, and especially after that walk, where you notice the outdoors, the sun, the clouds, the environment, the smells, where you try to loosen your body and experience the time, where it allows you to think a little bit more freely and clearly. And once you finish that event of exercise, take a moment to reflect and be mindful about that experience. And you know, many of us in our field use humor to cope, and I think it's an extremely positive thing. Just like any amount of time where we're using humor, we have to be clear about who our audience is. And I think humor in different levels and degrees is going to be important for us throughout a long duration event. And you know, part of this is having that sense of routine in our life. Create those routines around work, around your own prevention strategies. And, you know, many times when we think about this, and take a look at the self-care listing area, expecting recovery period after an incident, I really sort of, in our COVID-19 world right now, think the incident is not the big picture, but that moment when you're at work. What happens when you're done with work, and how do you charge your batteries and recover? What activities are you doing? What is your plan? And when we look at this, if it's going and getting food, connecting with people, we think a little bit more about how much do we ingest of the media. Perhaps we need to turn that off once in a while. We're going to look at more strategies on this in the next slide. All right, here's more strategies to think about. One of the important things I think about a lot is how we pace ourselves throughout our work and our daily activities. And sometimes we're our worst own enemies when it comes to pacing and the expectations that we create on ourselves. Over time, this is going to hurt us if we don't slow down and take time to recover. So one of the best ways to keep ourselves honest is creating a buddy system at work and with our relationships outside of work. The buddy system is really that way to check how well we're doing and to have honest and open communication with that buddy. And let people know, you're my buddy. You do check in every once in a while how you're doing, and you have to be honest with each other. And if you're struggling and having a difficult time, being able to back each other up is going to be really, really helpful. So it may mean, you know what, letting a buddy know that it's time. You got to slow down and take a break here. I'm noticing that you're stressed in your dialogue, or you're more withdrawn, can be some of the examples. And many times, sometimes we forget about this, but turn to your supervisors. Consult with them when you're not sure and when you're in doubt. Now, we may not always have all the answers, but we're surely going to listen and care about what's happening for each other. So simple stress management, strategies we've talked about already, as far as taking the breaks, eating healthy, knowing your limits, and talking about those limits become really important. All right, folks, we intentionally made this a very short presentation. It's now action. It's now time to make personal plans. What are you going to do? Create a list of the strategies we've discussed, strategies in the past that have worked for you, strategies that you've heard from other people, and do it. Act. Because our actions for today are going to affect tomorrow. And it becomes critically important that you have a plan. In closing, I want to thank you for your time. Take a look at these resources. Minnesota Department of Health behavioral website managed by Nancy Carlson has a great deal of information, or the metrohealthready.org also has resources. And in closing, I want to say the critical component I feel about this is recognizing there are going to be things we can control, and there are things that we will not be able to control. The key is having the wisdom to know the difference. I thank you and wish you the best.